Today we are going to discuss about the large intestine. Large intestine is a very large tubular organ present in the stomach. It is helpful for digestion of food and absorption. Digestion and absorption of the food. So what are first of all we will see its special features or relevant features. Large intestine is present like this. So what are these features, relevant features? First of all, it is very wide. It is very wide compared to the small intestine. It has a longitudinal muscle coat that forms a thin layer. These longitudinal muscle coat are organized into a three ribbon bands called as tinea coli. These are the band-like contractions of the longitudinal muscle. So what are the three tinea coli? Tinea. They are called as the tinea libera, tinea mesocolica and tinea omentalis. Tinea libera, which is placed in anterior position in the ascending colon, cecum, sigmoid colon and descending colon, whereas it is present inferiorly in the transverse colon. This is the only exceptional. Then tinea mesocolica, which is present on the posterior medial surface in the ascending colon, cecum, sigmoid colon and descending colon. Then comes the tinea omentalis. Tinea omentalis is present posterolaterally in the ascending colon, cecum, sigmoid colon and descending colon, whereas in antero-posterior position in the transverse colon. These are the longitudinal muscle coat. This is the characteristic feature of the large intestine. Okay. Next we go on to the appendices epiploicae, which are the small bags of peritoneum. Then what is the blood supply of the colon? Marginal artery of Drummond. Here the marginal artery present like this. It supplies the intestine, large intestine or colon. Then terminal branches of marginal artery are divided into vasa longa and vasa brevia. Longa means long, brevia means short. Lymph node, epicolic lymph node, paracolic lymph node and intermediate lymph nodes. The epithelium is columnar, but it does not have villi on its surface. These are the microvilli which are present in the small intestine for increased area of absorption. But here in large intestine no microvilli are present, whereas in small intestine microvilli are present. So this is a differentiating feature. Next we go to the cecum. First of all the cecum. Cecum is the starting point of the large intestine or the first most part of the large intestine. This like this the large intestine is present here. Okay, so here small intestine comes and ends into a blind opening which is called as the ileocecal junction. So cecum, it is 6 centimeter long and 7.5 centimeter broad. 6 centimeter long and 7.5 centimeter broad. It has a posterior relations and anterior relations. Anteriorly it is related to the muscle and posteriorly it is related to the right psoas and iliacus muscle. The nerves which are related to it are the genitofemoral, femoral and lateral cutaneous nerve of the thigh. What are the vessels? Testicular or ovarian, arteries and veins. Then vessels and nerves supply. It is supplied by the ileocolic artery, whereas the nerve supply is through the T11 to L1 sympathetic nerve supply. It is supplied by the sympathetic nerves from T11 to L1. Okay. Next is the ileocecal valve. Ileocecal valve. What is the structure of ileocecal? It has two lips and two frenula. Upper lip is horizontal, almost horizontal, whereas the lower lip is larger and concave. Frenula, left or anterior and right or posterior. How it is controlled? It is closed by a sympathetic nerves. Closes the ileocecal sphincter. Ileocecal sphincter. Mechanically closed by the distension of cecum. Whenever there is a distension in the cecum, it is closed. Then it is a large blind sac situated in the right iliac fossa. Then we move on to the appendix. So appendix is present here like this. It has a positions, different positions on the basis of a. So these positions are defined on the basis of the clock position 12, 6, 3, 9. Okay. First of all, its dimensions. It is of 2 to 20 centimeter long. 2 to 20 centimeter long. Lies in the right iliac fossa. Here the liver is present, and here the right side, right iliac fossa. Here the liver, appendix is present. It has a our hand of the clock positions. Retrocolic. This is the retrocolic position. Whereas the periileal and postileal. These are the two positions. Periileal and postileal is a 2 o'clock position. Then 3 o'clock. Promontoric. Promontoric position is the 3 o'clock position. Pelvic is the 4 o'clock position. Mid-inguinal is the 6 o'clock position. And the paracolic is the 11 o'clock position. So these are the positions of the colon, sorry, appendix. Then appendicular orifice. What is appendicular? It is present on the posteromedial aspect of the cecum, guarded by a wall of Gerlach, marked by a point 2 cm below the junction of transtubercular and right mid-lateral plane. So here the appendix McBurney's point. Here the umbilicus is present. Here the inguinal ligament is here. So lateral 1/3 and 2/3. Here the McBurney's point is present. Here you can see this is the McBurney's point. It is tenderness. This tenderness can be felt in the appendicitis. Appendicitis, there is a pain in this region. Peritoneal relations. How it is hanging or related to peritoneum? It is related to the peritoneum by a mesoappendix, also called as appendicular mesentery. Blood supply. Blood supply is through the appendicular artery, which is a branch of the lower division of the ileocolic artery. Ileocolic artery also supplies the cecum. runs behind the terminal part of ileum, anastomosis with the posterior cecal artery, supplied by the T9 and T10 nerves, sympathetic nerves segments. Then we move on to the colon, ascending colon, descending colon, transverse colon and sigmoid colon. Right colic flexure. First is the ascending colon. This is the ascending colon here. It goes upwards. Okay. Then transverse colon, then descending colon and sigmoid colon. It is present in the right side. Here the liver is present. This is called as the right hepatic flexure. It is almost 12.5 centimeter long. This is 50 centimeter long. This transverse colon, whereas the descending colon is almost 25 centimeter long and sigmoid colon is 37.5 centimeter long. This is the largest. Okay, so this is present on the right side. Ascending colon has a hepatic flexure. Here the hepatic flexure is present. Then transverse colon travels transversely and ends in the left splenic flexure, left colic flexure or the splenic flexure. Left colic flexure, it is also called the left colic flexure or splenic flexure, suspended by the transverse mesocolon. This is suspended by the transverse mesocolon, anterior related to the greater omentum and the anterior abdominal wall, posterior to the second part of duodenum, whereas the descending colon is 25 centimeter long, left colic flexure to sigmoid colon. From the left colic flexure to the sigmoid colon it extends. Then comes the sigmoid colon. It extends from the pelvic brim here until the pelvic brim to the third piece of sacrum. In midline sacrum is present. So the third piece, third sacrum, it extends until the third piece of sacrum. Then the histology of colon. What are the layers present? First is the mucosa, then is the submucosa. Sub means below. Below the mucosa is called as submucosa. Mucosa and submucosa. Then externally, muscularis externa. Muscularis means muscle, plus externa means externally. It is present externally. This is internally. Lumen, facing the lumen, is the mucous membrane. Then externally is the muscularis externa. Inside the lumen, mucosa, then submucosa, then muscularis externa. What are the features of mucous membrane? It has invaginations, like called as crypts of Lieberkühn. And submucosa, there is a nerve plexus present, Michener's nerve plexus, and also solitary lymphoid follicles. Muscularis externa is a longitudinal coat thickened to form tinea coli. This muscularis is thickened to form the tinea coli. So it forms a haustron, tinea and haustron. Inner coat is circular fibers. Outermost is the serous layer. So this was about the large intestine. Thank you.